I'm Dr. Charles Love. I'm a professor of medicine and director of cardiac rhythm device services here at Johns Hopkins Hospital. My specialty is cardiology and specifically cardiac electrophysiology with special certification in the area of device management, which means I like to take care of people who have pacemakers and defibrillators. I see thousands of patients every year. I've put in over 9,000 pacemakers and I've removed over 2,000 pacemaker and defibrillator wires from the patient's hearts. It's important that when a patient has had a problem with a pacemaker wire or defibrillator wire, especially if there's been an infection on one of these wires, that these wires be removed. And that's a challenging procedure to perform and one which I've been doing since the early 1990s. I was the first cardiologist to use a laser to extract a pacemaker wire from a person's heart. Since that time, removing thousands of wires, I maintain a very low complication rate and an extremely high success rate in removing these wires. My philosophy of care for taking care of patients is very simple. I like to do as little as possible to achieve the best result as possible. I'm very personal with patients. I spend time with them, understanding their needs, and try to tailor their care specifically to what will work best for that individual patient. I chose cardiac electrophysiology because even as a child, I loved electronics, programming computers, and I always liked surgery, so it was the perfect field for me to go into. My specific research interests involve better ways of removing wires so that they can be removed safely and more completely. I also like to make sure that new devices that come out have the best algorithms to work with an individual patient's heart rhythm to give them the best result as possible.